the gross anatomy in the laboratory, and we will spend our time together in lecture discussing physiological peculiarities of the chambers. You already know that heart consists of 4 chambers. There are 2 atria and 2 ventricles. This is a right atrium, right ventricle, left atrium, and left ventricle, correct? Okay, so let's start our discussion with atria. Atria receive the blood from the circulatory system. They are not very large chambers. They do not have very thick walls either, because all they have to do is to pass the blood into the ventricles located right below them. So no great force needs to be developed to propel the blood. There are a few peculiarities in their anatomy. Atria extend forward, forming kind of like pockets, and those pockets are called auricles. Auricle means an ear, and that name comes from the appearance of the auricles. They kind of look like elephant ears on the front. And this is the anterior surface of the heart, and this is a portion of the right atrium that kind of extends like a pocket. And this is a left atrium. So these two are called auricles. Here's another one, auricle and auricle. And the second thing here is the pectinate muscles. Pectinate muscles are found on the inside. They form thick ridges that extend from one wall of the atrium to another, and they help the atrium contract more efficiently. So here you can see an opening into the heart, and you can see pectinate muscles. They do look like the bristles of the comb, don't they? Hence the name. Ventricles are much larger chambers. They also have thicker walls because their job is to discharge the blood into the circulatory system, and that takes quite a bit more force. They also have papillary muscles, which are projections of myocardium into the chambers. They look like finger-like projections. If you look at your index finger, that's about the size of your papillary muscle. Probably not as long, but about that thick. So you have 2 papillary muscles on each side, and their job is to attach to chordae tendineae and hold on to the atrioventricular valves so that they do not open into the atrium and hence prevent the blood from flowing back into the atrium from the ventricle. Trabeculae carni are trabeculations in translation. They're also extensions of myocardium into the chamber that make the contraction of the ventricles more efficient. Let's look at a couple images. Here you can see an opening flap that allows us to look inside the right atrium, and here is a finger-like projection. This is a papillary muscle. And you can see that the inner surface is not smooth. All of those are trabeculae. Make sense? Okay. Now, how do chambers compare size-wise? Right and left size of the chambers is about the same. In other words, right atrium and left atrium are about the same. A right ventricle and left ventricle are about the same in volume. They hold about the same volume of blood, which also should make sense because right and left side of the heart contract simultaneously. So if you were to have right ventricle bigger than the left and they form a closed system, then in just a little bit you'll have a backup in the system, right? So this diagram demonstrates very well that the thickness of myocardium is not the same, but it is misleading, making you think that the chamber here is larger than here. It is incorrect. Chambers are the same right to left. Okay? Now, wall thickness is a completely different story. I already mentioned that atria have relatively thin walls, very flimsy. They're just maybe 1/4 of an inch in thickness, very thin. And again, that's because atria do not have to pump blood very far. In fact, if your atria quit working altogether, you probably wouldn't notice. That's why atrial infarctions are very commonly overlooked. Your atria become significant, or their function becomes significant when you exercise. At rest, they only contribute to about 5% of your cardiac function, whereas with exercise, about 40%. So again, atria have a thinner myocardium. How about the ventricles? Well, ventricles in general have a thicker myocardium because they have to propel blood further. Now, it's important to note that left ventricle have thicker walls than the right ventricle. Why is that? Well, because blood from the right ventricle goes to the lungs. And where are the lungs in comparison to the heart? Well, they're just right by it, right? So again, we don't need to push very hard to propel blood into the lungs. Whereas the left ventricle propels the blood into aorta, and from the aorta, blood goes to the entire body, all the way to your toes. So that takes a bigger force to propel blood that far. Therefore, myocardium in the left ventricle is much thicker. Now let's talk a little bit about the valves. In general, the valves are passive flaps of tissue that prevent the blood from going backwards, or in medical terms we call it a retrograde flow. We don't want it to go backwards. There's never a muscle within the valve itself. So valves open and close passively based on the blood pressures on the two sides. There are 4 valves in the heart. 2 are found between atria and ventricles. We call them atrioventricular valves. And 2 are found on the exit from the heart. They are called semilunar valves. Well, let's first look at the atrioventricular valves. As I mentioned, they are found between atria and ventricles. On the right, we call that valve a tricuspid valve because it has 3 cusps, and it separates right atrium and right ventricle, preventing the blood from going backwards from ventricle into atrium, right? On the left side, we have a mitral valve, also called bicuspid valve, and it prevents the blood from going from ventricle back into atrium. Now, let's look a little bit more at those valves on some images and see maybe how they work. This is a view at the tricuspid valve. You are peeking into the right atrium, and you can see the flaps over here very flat, and they are attached to chordae tendineae, and chordae are attached to the papillary muscles. So basically what happens is when the pressure in the atrium is high, it pushes the valve open and the blood goes into the ventricle. When ventricle fills up and contracts, blood wants to go in any direction away from high pressure, so it will try to go back into the atrium. However, this door, if you want, cannot open in the opposite direction because contraction of papillary muscles will pull on the cords, and the cords will only allow it to go far enough for the valve to close, but not to open into the opposite direction. Make sense? So here you can see a superior view, cross-section through the heart, and this is a tricuspid and a bicuspid valve, and hence, of course, the name. Tricuspid has 3 cusps, and bicuspid has only 2, right? By the way, sometimes students ask where the name mitral valve came from. Mitral refers to bicuspid valve, and it actually is a very, very old name, and it comes from the Catholic Church, actually. One of the headdresses for Catholic priests is called mitre. It has 2 segments, just like a mitral valve, hence the name, okay? All right. That diagram shows you how the mitral valve operates. You can see the 2 cusps, 1 and 2, and again, when the pressure is high in the atrium, blood goes down very easily. When the pressure is high in the ventricle, it wants to open the door in this direction. However, chordae, with their high tension in them, would prevent the valve from opening in the opposite direction. Make sense? So, tricuspid and bicuspid valve function very similarly. How about semilunar valves? Semilunar valves are found on the exit from ventricles. So aortic valve is found between the aorta and the left ventricle, of course, and pulmonary valve is found between the pulmonary trunk and right ventricle. And their job is to prevent the flow backwards into the ventricle from the outflow vessels. They have completely different anatomical structure. Let's look at this image. We are looking at the aortic valve. It's open for us and unrolled if you want. And what you can see is the round or semilunar cusps. So the ventricle is over here and the aorta is over here. So When the blood pushes from here, it moves those valves out of the way. But when the blood wants to go from high pressure in the aorta back into the ventricle, those cups fill up and they seal the opening. So there are no chordae, there are no papillary muscles that help these valves close. It's just their anatomy, their cup-like structure. Make sense? All right. So here we are looking at the section through the heart, and you can see atrioventricular valves have flat flaps, where the semilunar valves have round leaflets. Now let's look at this animation that demonstrates how those valves work.